welcome. Welcome to the day number 2 of the Virtual Islands Summit 2023. Thank you so much for joining the session. I'm Audrey, the Director of Business Development at An Innovation, and I'm based in the islands of Guadeloupe in the Caribbean. I'm very happy to presenting to you this session, this Island Stories session, where we talk about providing healthcare to remote locations. Remote islands, we know, often face formidable challenges when it comes to accessing to adequate healthcare. Due to the isolation, the limited infrastructure, or the unpredictable weather condition that we all know have historically created challenges to deliver the essential medical services needed. However, the visionary team of Flying Whales has taken the skies to bridge that healthcare gap. But before we begin the session, you should see a poll appear on your screen right now. I guess, yes. So you see there is a few questions. We would love to know where you're from, what region are you connected from, what sector are you working on, what is the industry. We are very curious to know who is listening to us today. And so take the time to do it. We would love to create more links with you, and I invite you to use the chat function today to introduce yourself as well, your name, and when you're joining from, make any comments during the session. If you have questions for our speaker today, please make sure you use the Q&A button. It's on below on the far bottom of your screen. It's just written Q&A, and that function can help you write your question, address them today, and we will make sure to address them as many possible we can today. Very shortly, we'll see the results of the polling. I'm very excited to know where you are coming from. I see here. So, okay, we have 34% from the Caribbean, 25 from Europe, 22 from North America. We have South and Central America, 9% from Africa. Lots of private sector, 50% of you today, 9% of the government, and 16% NGO, 13 academia. Lots of you coming from the environmental services and ocean conservation. And I see waste, circular economy. That's great. In the chat, hi Trinidad, Cabo Verde, the Seychelles. That's great. Well, let's jump into the topic, how we provide healthcare to remote locations. I'm very happy to introduce you to Florian Lamy, Sales Manager at Flying Whales. Hi, Florian, how are you?
Hi, Audrey. How are you doing?
Doing good. I'm very happy to have you today. Let's just back up in the question. So could you please provide to us an overview of Flying Care project and how it aims to address healthcare challenges that face the remote islands and remote places?
Well, first thing, good day to all, and thank you for the invitation to this virtual summit. We are thrilled and honored to participate to such events. For introduction, our company Flying Whales is developing an ambitious aeronautical program called LCA60T with the development, production, and exploitation of large capacity airship able to move 60 tons of cargo from point to point. Among the numerous applications and logistics, the Flying Care project has been developed to support health and humanitarian sector. The starting point was to consider that according to the World Health Organization, 50% of the world's population do not receive the care they need. 2 billion people do not have access to safe surgery, and one of the causes of this inequality is limited access to essential care. To meet these challenges, the ideal solution would be to fly a full-scale hospital as close as possible to where it's needed, using the LCA60T airship. That is the purpose of the Flying Care project.
That's very exciting, and and quite new. So what makes it happen? What is the characteristic of your airship, and how does it suit to be an hospital? What are your unique characteristics? How you made it happen?
The LCA-60T for large capacity airship will transport 60 tons from point to point. It is what is called a lighter than air technology, using helium gas that is kept inside its large envelope, which is 200 meters long by 50-meter diameter. It is powered by a hybrid propulsion system firstly, and soon a fully electrical propulsion system for low carbon transportation. It is, to give you an example in comparison, it will be 20 less emissive than for an helicopter, for instance. The operational radius of the LCA-60T for each mission is up to 1,000 kilometers with 60 tons of payload. It is flying at 100 kilometers per hour, so it will augment connectivity and responsiveness capability between territories. Its maiden flight is scheduled for late 2025, and we are therefore entering the final 2 years of a 10-year development, which involves public-private funding and a technical consortium of 50 world leaders in aeronautics. One of the aspects that makes this program unique and relevant for remote territories and islands is the ability to load and secure the cargo, then unload it safely in a hover, like an helicopter, hovering at 50 meters above the ground, so we don't need supporting infrastructure. The airship remains in the air during the operations with no impact on ecosystems. When in service, medical or emergency supply or the mobile hospital itself can be easily dispatched from a location to another during a scheduled medical tour or on demand, depending on the situation and the priorities defined by the health authorities.
That's quite impressive, Florian, and quite technical. Did you, so we hear, there is a lot of people from Cabo Verde, we see IT, Niue. So how do you anticipate the challenges that can face islands and the remote places with that flying hospital? Did you elaborate it probably prior? Can you tell us a bit more about those challenges you had to incorporate in Flying Whales and Flying Care project?
We have to anticipate that the mobile hospital will need several supply to be fully operational, such as, for instance, we will need water, electricity. We need to have some connection with the island grid. So to avoid being a burden for the local communities, we have to anticipate that the airborne technology must be fully autosufficient. Such finally, when we arrive into the country where we're going to operate, we will immediately start the process and start receiving people to proceed with either diagnostic or with the health services itself.
Okay, and so in the process of Flying Care, so you are in the testing phase, but I heard that you already are anticipating great partnerships. What role does cross-sector multi-stakeholders partnership play in the Flying Care project? How do you involve the multiple stakeholders that are engaged into implementing such a project?
We have several dimensions to this project. Firstly, at a global scale, we have created an international consortium of experts, of health specialists, also with industrial partners and international organizations. All of these people have worked together, such finally we have defined one architecture of the overall system that is composed with several components that are modular. And then depending on the exact needs locally, we can adapt the overall architectures and exactly fit to the local requirements. So it has been quite a long process since the last 2 years that we bring together all of these people and then connect locally with the health authorities, with academic partners as well, with health specialists and with community leaders to better firstly have a tight understanding of the local health needs, and then together propose solution with medical equipment on board, with special educational platform also, such we can train people locally. And we have developed this kind of solution on a case-by-case basis directly with the concerned authorities.
In the concept in the context of island healthcare, so what challenges, what do you anticipate to address those challenges of, I guess we have the weather and also so how do you anticipate to deploying a mobile hospital by air, and what strategies are you having right now, and who are you working with? We would love to know who should contact you as well. So can you tell us a bit more about that testing phase of Flying Care project?
Yeah, sure. For the moment, we are working in different regions of the world, which can be not only island system. We have worked with sub-Saharan countries, with north of Canada, with African countries as well. Also with some island communities in Indian Ocean and in Caribbean region as well. When we try to enter into a country, firstly, we reach the Ministry of Health or the relevant health authorities, and we propose them this mobile infrastructure, mobile health infrastructure, to be a complement to the existing health system. The way to proceed then and to propose an adapted solution is to open the dialogue on what can be proposed in terms of equipment, in terms of health services from an integrated point of view, from the diagnostic phase and imaging equipment to the curative phases with chirurgical theaters that are also part of the mobile hospital structure that we are transposing from a location to another. So the best way to be in touch with us, firstly, is to contact with Flying Whales team, of course, but also to connect with Island Innovation, as we are very glad to say that we are a partner of Island Innovation organization that is bringing together a community of people and a certain number of projects and initiatives worldwide that is driving a positive change for island communities. And we are very glad through this channel to meet people and collaborate further, to have better understanding of the local needs, and then incorporate excellence and incorporate complementary point of view, such finally it will benefit in a better way to the final communities.
I have a question here. Have you approached the Cabo Verde Islands?
Not yet. We had the pleasure to work in Caribbean region at different scale. Firstly, with some countries like France, in Martinique, and also still in the region, we had the opportunity to work with United Nations agencies to anticipate some emergency scenario in case of humanitarian aid. And for this purpose, we develop case studies that can be then triggered with United Nations or at country level. And we're very glad to initiate dialogue, of course, in this country.
Thank you, Florian. Just asking my colleagues, can we go back to what the airship looks like, so the audience can have a vision of, if you can find the slide where the flag, the airship is, I think it would be very helpful. And meanwhile, so question, so someone just asked, have you approached Cabo Verde So as you mentioned, we are a partner. What do you what would you like to be interested into working with us? And can you elaborate the partnership between Flying Whales and Innovation? What benefits, Allen Innovation can bring you to this collaboration as you as a technology provider, a solution provider? What interests you?
Sure. We have to mention that firstly, we had the chance to start our relationship with a very good example and a very good case that has been worked together initially. And based on this, firstly, very positive relationship, we have elaborated how it was possible to give an additional echo to these works and to this development. And thanks to Island Innovation Network and platform of media, it is possible for us to showcase these works and what has been successful with certain communities and propose this material to other communities facing the same challenges. For us, as we are promoting a clean technology in terms of transportation of cargo, but also a very impactful project with the Flying Care program itself, we are very glad that we have the chance through Island Innovation platform and communities of members to initiate other dialogues, to bring additional elements to this platform of health and to this platform of educational platform that is together part of the mobile hospital, and find new services that will be relevant for people. Some of the cases which have been developed so far that you have on the screens, for instance, have been realized for some UN agencies, but also some governments, like in Indonesia, for instance. And for them, we have developed humanitarian aid scenario that can be on similar basis developed for other island systems, understanding what could be the emergency, where the emergency supply should be located, and how it is possible for us in a very limited hours of flight to be immediately on site with 60 tons of vital cargo per rotation. And that is the purpose of what we are providing. It's a medical tour and the possibility to put in place a program and scheduled health program on a territory or on demand, if depending on the situation it is appropriate, immediately send what it is required for the population.
Yes, so from what I understand here, health, it's not only an hospital, it's also after a disaster, the ability to come with goods for recovery as well. There are multiple phases of what health is. There's prevention, but there's also recovery. And from what I see in Indonesia, it's about recovering after a disaster scenario. That's right.
Yeah, you have to anticipate that if you are facing a major event, then all of your infrastructure, the existing ones, may become inoperant. So it might not be possible to use them as usual to bring vital cargo, such as medical supply, equipment, water, or drugs, or mobile infrastructure, such as, for instance, a component of hospitals. Usually, all of these infrastructures cannot be operational right after. It can take days or weeks, and this time is critical to save lives. On our side, we have this technology that can be very impactful because immediately in a few hours, we can go to the epicenter of the crisis and propose relevant material depending on the need. So we have to work together. It's really a cooperative anticipation. And so we work with numerous people as local authorities to prepare a plan that it is suitable and depending on the needs, adapt the architecture of the mobile hospital and come directly with it on the field.
And that's I can hear about adaptability. Someone else asked, but Cabo Verde is in the middle of the Atlantic. How would you react to this? How does it sound so achievable according to Flying Whales?
Usually, we are quite numerous now. We are several hundreds of people, including operational team. We are usually working and preparing feasibility studies to be sure, firstly, that we can achieve this and reach the island and the area of work. So initially, we start with the feasibility studies, then we go into the details and try to better understand in the health sector how we can achieve and how we can create additional capabilities locally. Providing firstly this infrastructure on a temporary basis, and then on a more sustainable perspective, how it is possible to train people and medical staff, for instance, and to have some health instructors, health experts and doctors that are going to be with the airship in another location, go and train the people, such finally we will increase and provide more resilience to this territory. So it is a matter of studies firstly, and a common dialogue with a lot of different bodies, experts, member of the civil protections, for instance. We have the chance as part of our international consortium to have people with field experience that is critical, people that are working in academic research and science field that are willing to make the bridge between their study, the theoretical background and data that they have on their side, and the accurate elements that we can face on the ground. So this airship is also a bridge between different kind of people that are going to work together to better understand the needs and then coordinate the answer accordingly.
What is your vision, Florian, about healthcare in remote communities? And what is the vision that you have? And how do you think Flying Care fits that vision?
It's we have the chance exploring all the capabilities of this program, not only the Flying Care program, but also having a new technology that allow us from point to point to reach the unlocked world and connect this to the global economy. It is possible for us to imagine a lot of different applications. And at the moment, we are exploring a lot of different aspects. For instance, regarding a better connectivity of island systems, such people and cargo can better circulate and share their resources that are most of the time limited, so we can better share this resource. Then we have also the possibility to go on energy aspects, on a waste management aspects. So all of these topics are explored, works during several studies with United Nations, for instance, or directly with local authorities. We try to show how it is possible to implement such a solution. We are not a solution maker. We are part of the solution, and we need additional people to bring their own excellence and their own program. Such together, we are going to find a solution. For instance, on waste management, we cannot collect the waste, but we can transport the waste. And it is particularly relevant, for instance, considering plastic waste. In Caribbean region, we had the chance to work on that. And also to transport the waste to the appropriate disposal location, which can be also relevant, for instance, when we are talking about Sargassum. So all of these matters require to go in more deep exchange, and we will be very happy, thanks to Island Innovation, to connect further and to give more echo to the previous works.
And Fern, that makes me just wonder, before we close, how greener you are. We talk about transportation, and we know the challenges of transportation from the Caribbean to mainlands, and you know, cargo are rejecting a lot of carbon. So can you tell us as well how Flying Whales as well innovate in terms of carbon and also the respect of the renewable energies in that matter?
There are different elements to your questions. Firstly, as we are developing a lighter than air technology, So we are flying thanks to the helium gas that is inside the envelope, meaning that we are not going to consume energy and fuel, for instance, only to win gravity. We immediately win gravity thanks to the helium gas. We only consume fuels, for instance, for the first generation of the propulsion systems. Then when we are going to be a fully electric, it will be a different propulsion system, but we don't need to consume energy immediately to win gravity, meaning that in comparison with the other mode of transport, mechanically, we are immediately lower in terms of emission during the operation. Then the second aspect that has a major impact is that as we don't need any ground infrastructure in support to operation, we just fly to a work site above the ground at 50 meters. We load the cargo safely, then we unload it in another place, and we never land. So we don't need to create artificial area where we would have to land. So also this footprint is saved, and the particular sensible ecosystems in islands, for instance, don't need to be changed for that. We can fly immediately, operate, and we move on after the program without any impact in terms of infrastructure.
Thank you very much for the answer. I have a question from Peter. Peter, many islands communities share characteristics of small, dispersed population with limited capacity. How does your flying care address these key criteria?
Usually when you're having an island system, you have one place where you have centralized health services and excellence. And this place is kind of costly, having one hospital in one place. So it is very difficult to replicate that health infrastructure and to invest massively for people being in the furthest locations. So that's why it is interesting when we provide a mobile equipment is to extend the existing capabilities that we have in one place, and then to be 1,000 kilometers away if needed, and to transpose that excellence of services in the location where the assistance is needed. So yes, you have this investment initially that it is an important barrier to having a large health system, and thanks to this technology, we can offset that difficulty.
Okay, that's great. And I have a last question here. I guess that's from flying care point of view. I have two questions actually. How will the waste generated from the flying care will be managed?
So it is clearly one point that we have to pay attention. And there are a lot of different wastes that can be generating during the operation. Normal waste, but also medical waste, hazardous materials, and so on. So the solution should include this kind of understanding of the life cycle of the waste. And when we leave the hospital structure locally, go back with that waste to the initial point, such it can be properly treated. That's the same for any logistic operations where we are going to intervene. When you arrive in one place, you come back with other material in return, which can be, for instance, wastes, or it can be biomass, for instance, when you're working with agriculture in the agriculture field. If you're sending some supply in terms of fuel or in terms of gas bottle, then you come back with the empties. So all the time we are anticipating the field in a way and in return. And for the waste, we are going to do the same. Okay,
that's good to know. And what about, last question, I guess, for today. Thank you, everyone. It's just, I think, the right time. And last question. So Haiti. So when I guess someone asks, is a vulnerable place. And it has several aspects, we know. Do you have a plan to include vulnerable places that are facing social challenges? Is that topics you had in mind?
Yeah, sure. One instance would be, for instance, in Indian Ocean, we are working at regional level, considering the different islands present and what are their structural needs. And we try to find synergies. As we have one major system, thanks to the LCS 60-ton airship, we have the ability to connect people and to answer to these different needs so we can mutualize the solution. So it is the case in Indian Ocean when we are working for Madagascar, for Comoros, for Mayotte, for instance. And that's the same also for Caribbean region. We started by Martinique, where we had the chance to be welcomed and to work on the health systems with doctors and neuroscience doctors. So it has been a very good starting point in that region. Then we have the chance also to develop, since a couple of years from now, humanitarian aid scenarios that is also helpful to understand in how many times we can go from a place to another and where we would have to put the supply, for instance, to respond more quickly. So it's a good starting point. Then, thanks to Island Innovation, if we have the chance to go in more detail, to enter in dialogue with people from other community, it will bring another pulse in the program in other region, or we'll go in more details. So we'll be very glad, thanks to you, Audrey and Island Innovation, to have the chance to go in that level of discussions.
Well, thank you, Florian, for joining us today. I think that was a really great conclusion for today. Can you tell us and tell the audience how we can contact you? What is the best way if they want to get involved and dive deeper into flying care and flying whales in the next days?
So considering the Flying Care project, we have an international consortium of experts and partnering bodies. We'll be very glad to receive your contact, which can be done by our website, flyingwhales.com. Regarding the Flying Whales activities at a more large scale, by Island Innovation, firstly, or directly by contacting us, it is also possible to explore what could be the applications for your territory, which can be in the health sector, but also in other numerous fields. We have some matter which can be shared.
Thank you very much, Florian. Thank you, everyone, for joining the session. This is the end of the Island Stories, and we have make sure that I saw my colleague Maria. Thank you, Maria, for putting all the session of today. Is it in the chat? So feel free to jump into the other sessions, and it's still up all week long. So you can also follow us on our social media: Instagram, Twitter, Facebook, and LinkedIn, of course. So get in touch with us if you need. I am also very active on myself, Audrey Joachim, on LinkedIn. So feel free to reach out, and I wish you a beautiful day, evening, wherever you are, and we have as well the event that's coming up. So thank you very much for joining today. Thank you.